Hello, Mr. Sexton. I'm Pam, and today we're going to do your head-to-toe assessment. Is that correct?
Yes.
All right, we're going to get started with your vital signs first of all. So we get a temperature. Put that under your tongue for me.
Okay.
And it's okay if you use this arm. First thing I'm going to do is do an auscultatory gap. Okay. So that was about 110. So we're going to pump up to about 140 when I do the blood pressure next. You get your pulse while we're waiting for the blood flow to return to your arm. Okay, that's 80. Let's see what your temperature. 98.2. I'm going to get your blood pressure. It's 128 over 78. This is very good. Are you having any pain today?
No, feel pretty good.
I'm going to look at your skin first of all. A little bruise there, a little abrasion. Check your capillary refill. And that's less than 3 seconds. That's very good. Now we're going to check the skin turgor. Very good. So that tells me that you're not dehydrated. So that's a good thing. Now, if you could, I need to have you put your thumbs and your fingers together. So start with your thumbs so that I can see the angle there. And then go on to the next finger. There you go. Good. And the next. Good. And next. And one more time. Good. I don't see any clubbing or anything like that. Now we'll look at the skin on your legs. So you have some psoriasis here. Another abrasion. Okay, and just check the capillary refill in your feet here. Good. Okay. Now if you could just sit up straight for me. Good. And your head is midline, symmetrical. And can you swallow for me? Good. And do it one more time. All right. And that's midline. Okay. Now I'm going to feel your head here. Okay. You do have some male pattern baldness, I see.
Is that noticeable?
It's movable. Any tenderness back there?
No.
Okay. While we're here, we're just going to feel your lymph nodes. We have the pre-auricle, post-auricle, parotid, submandibular, maxillary, submental, and then we have the anterior cervical, posterior cervical, deep cervical, and the clavicle, and I don't see any enlargement. Was there any tenderness there?
No.
All right, now I'm going to take a look in your eyes, and I need to turn this light off just a minute, okay?
Okay.
All right, and just look straight at me, please. Okay, now I'll come close and look into your eye. Okay, so the red reflex is present bilaterally. I can see the retina. This looks good. There was no cupping that would tell me that there's any glaucoma. I can see the macula densa, which is gray, and then the center of that, which is the center of vision. All that looks good. And then we have the vessels and the arterioles and the venules, which are 3 to 5, and I don't see any nicking or crossing of that. So that all looks good. All right. Now let's go. Let me look at your pupils first, okay? All right. Good. Okay. Now let's turn the light back on. We can do that now.
Thank you.
You're scared of the dark.
No.
All right. So now I want you to look back over that wall there. Focus on that. And then when I tell you to, if you'll just change your focus to this pen. Okay?
Okay.
All right. And now, good. And then follow it in. Very good. All right. Now I want you to follow the pen with your eyes. Okay? All right. Very good. Very good. Okay. So that we were testing your cranial nerves number 2 and cranial nerves number 3, 4, and 6, which is the oculomotor, the trigeminal, and the abducens, which all deal with oculomotor movement, so moving your eyes around. We would test your vision with the Snellen chart, and that would be far vision, and with the Romberg, which would be the near vision. Okay. All right. Now, let's take a look. And your vision would be the optic cranial nerve number 1, which is the optic nerve.
Gotcha.
All right, let's see. Now we're going to take a look at your ears. Any soreness there?
No.
Okay, so I can see the malleus and the umbo. The eardrum is not swollen. I don't see any wax buildup or anything like that. And that's the same. going to test your hearing, and this would be the cranial nerve number 6, which is the acoustic. So what I'm going to do is place this on top of your head. If you can just tell me if you hear it in the right ear best or the left ear best or both equally. Can you hear both sides?
Yeah, pretty much both sides.
Equally? Okay, good. Now I'm going to place this behind your ear. You just tell me when you hear it and when it goes away.
Okay. You hear it fine. It's gone.
And
Still can hear it, yes.
Okay, tell me when that's gone.
Gone.
All right. So bone conduction to ear, air conduction is 2 to 1. So that was pretty normal there. Okay. So now I'm going to, this is soft. Let's just touch this. This is soft, and this is going to be sharp. So what I need you to do is to close your eyes, and then I'm going to touch different areas of your face and tell me if it is soft or sharp. This is testing cranial nerve number 4.
Okay.
No. 6. 5. Trigeminal nerve.
Okay.
Sorry. Okay.
It felt soft. Felt a little rougher. That felt soft. That also felt soft. That felt a little rougher.
All right. Very good. Okay. I'm going to take a better look at your eyes, okay? All right, just going to look at this. Okay. They're a little bit pale. The irises are blue. Pupils are round and equal. Can you squint your eyes? Okay. And try to keep them closed as I try to open them. Good. Okay. Very good. Now we're going to test cranial nerve number 7 with the facial nerve, which is facial gymnastics. So if you can, you're smiling.
I get to make some faces.
Smile, and you already did that with smile without showing your teeth, and now you're smiling with your teeth. And then you purse your lips together, puff your cheeks. Okay, stick your tongue in the side of your mouth. Good, very good. And then can you clench? Good. All right. All right. Feel this here. Okay, grit your teeth again. Good. Can you slide your jaw out? Good. And back. I don't feel any TMJ or anything like that. All right, and let's see, we already said we are midline there and we swallowed okay. So I'm going to check your thyroids. Come behind you. Need you to lean just a little forward for me, and then turn your head over to the side. Just lean that over. There you go. So what I'm doing is palpating your thyroid. I don't feel any nodules, any swelling. Okay, same thing on the other side. All right, okay. Now, let's see. Can you shrug your shoulders? Shoulders up, okay, and against me, hold it. Good. That's the spinal accessory nerve, number 7. No. It's number 8. Okay. Now, let's see what we do next. All right, now we're going to do an examination of your chest. Could you take your shirt off for me?
Can I lay it over there?
That just throw right there on the bed. Okay. So, got a little bit of abrasion on your left upper chest. And I don't see any pulsations of your carotid or anything like that. Let me take a listen to your thyroid. We're just going to listen to your carotids. Okay. All right. So let's see. I'm going to get you to turn that way on the chair. All right. And every time I touch your back, if you'll just say 99 for me.
99, 99, 99, 99.
Good. All right. Just listening to your lungs. All right. Okay, so what I need you to do is take a deep breath in, and I'm going to and hold it for me. Okay, you can take a breath for a minute. Now, when you're ready, take a deep breath in and hold it for me. Okay. Now, let it out. Let you breathe for a minute. And now, if you take a breath in and then exhale and hold your exhale for me. You can breathe normal. 6. Normal is 6 to 12. That's very good. Okay, now I'm going to listen to your lungs in the front. Deep breath. Just breathe it in and out normally. Deep breath. All right. Now I'm going to listen to your heart. So if you'll point a maximum impulse. Go down. So the 5th intercostal space, midclavicular line. I'm listening to your mitral valve. it up to the fourth intercostal space, left sternal border. Listen to the tricuspid valve. Now we're listening to the Erb's point, which is the third intercostal space, left sternal border. And the second intercostal space, left sternal border. Listen to the pulmonic. And then the right intercostal space, right sternal border. Listen to the aortic. And I hear S1 and S2. No extra S3 or S4 sounds, so that's good. And I do not hear any murmurs of any kind. Okay, now if you could lay down here on the bed for me. Alright, so now we're going to do abdominal exam, okay? First I'm going to take a listen to your stomach. And all four quadrants, we got good bowel sounds in all four quadrants, so that's good. And now I'm going to percuss your stomach, okay? We're going to do all four quadrants here. And we went lower here on in your bladder. And I won't go down there, but we would have tympany here and then dullness over the bladder. Okay. Now I'm going to percuss your liver. Okay. Find out for this. And I'm just measuring the liver span, okay? All right. And that's 5 normal minutes. All right, now I'm going to do some palpation, okay? And you just let me know if there's any tenderness, okay? So the liver will not be palpable. Liver. All right, it's not enlarged. It is smooth. All right. I'm just going to lift up right here. You just continue. Try to make this a little odd here. Okay. All right. Now, let's see. Now we're going to work on, I want to test your hip movement. So, can you raise your leg up off the bed? Good, straight. Bring it on up. Yeah, okay. And down. Good. That is flexion up and extension down. And we'll test hyperextension when you stand up. If you could do that against me, pushing against you. Good. And down. Good. Now, you raise your knee, raise your leg up and bend your knee. Okay. That's flexion. And put it out in extension. Okay, and let's try to do that. Raise your leg up, keep it up here, and flex against my leg, my hands, good, and out. Good. All right, we would do that bilaterally. All right, now with your hip again, we're going to do external rotation and internal rotation. So I need you to take your knee and place it next to the other knee. Can you do that? Good. And out this way with your foot up that way. Okay. So we had internal rotation and external. All right, put your legs straight. And we would test bilaterally. All right, can you raise your foot up toward your nose? Good. That's dorsiflexion. And down, plantar flexion. All right, and we did that against resistance, and we would test it on both legs there. Okay. Now I'm going to feel all your pulses while we're here. This temporal. Carotid. Brachial. Radial, and we're going to defer the femoral. Just bring your leg up here. Popliteal, okay. And posterior tibialis. And dorsalis pedis. All right. Now, if you could stand back up for me, and I'll let you actually put your shirt back on. Okay. Now, if you can keep your leg behind you, that's hyperextension of your hip. Okay, so we got the hip covered now, and I'm going to need you to turn this way a little bit. Okay, so put your hands out for me. Okay, so this is supination and pronation. Okay. Do that. Very good. And hyperextension, extension, and flexion. So of your wrist. Now let's just do your fingers. Okay, so flexion, extension, hyperextension, okay, abduction, adduction. Okay. Now, if you push down against my hands, good, and pull up, good, okay, and can you do radial inversion and eversion, radial and distal eversion? Very good. Okay, now let's test your elbows. Okay, so extension and flexion, good, and do it against my hands, good, and up, very good. Now we're going to test the shoulders. So we would do extension, diving, very good, and That's flexion. This is extension, hyperextension. Good. Let's see, inversion, eversion, and inversion. Very good. And then adduction and abduction. Good. All right. Now, if you would, you can put your arms down. Okay. Now, if you would walk across the floor for me. Good. And if you come back, do a heel to toe. Very good. All right. Turn back towards me. Okay. And close your eyes. Okay. And put your arms out, straight out for your sides. Okay. And then I want you to touch your nose. Start with one arm and then the other one. And the other. Good. And then put your arms down. Keep your eyes closed. Good. That's a negative Romberg test. You didn't fall down on me. Okay, now let's do your, you can open your eyes. Okay. Let's do your neck. Let's do flexion, extension, hyperextension. Okay. Lateral, other side. Okay. And rotation. Okay. And now if we do that, push against my hand, good, and back, good, and then turn side to side, good, and this way, good, okay. So we got the neck, shoulders, elbows, wrists, fingers, hips, knees, feet. Okay, so we got that done. Now, let's see, if you'll sit down here for me. All right, we're going to do your deep tendon reflexes. Okay, first of all, we're going to do brachial. You just bend your arm, actually, to the triceps. And the brachial radial. Good. All right, now we're going to do the patellar reflex. If you put your hands together and pull, and look that way for me. Okay. All right, you can stop. All right, now we're going to do the Achilles. All right, very good. So now I'm going to, this is going to be sharp. Okay, it is sharp, so really be careful. And this is dull.
Okay.
So I'm going to have you close your eyes and you just tell me if you feel sharp or dull and tell me where, or point to where you feel. Okay?
Okay. That would be on my arm here. I think that would be like sharp.
Okay.
That's my other forearm, and that's dull. That's the back of my calf. I couldn't really tell sharp or dull, though. That's dull. That's the back of my other calf, and I felt it was sharper.
Okay, very good. One thing we forgot to do was check out your mouth.
Oh, okay.
And your nose, so let's go back and do that. Okay. Good. Smile. Okay. Teeth are nice and clean. Okay, open your mouth. All right. Come on, loose. Okay. Upper frenulum is intact. Lower frenulum is intact. And you raise your tongue up. And that's good. Vessels are good there. Glands are good. I didn't feel any calcifications or anything like that. think we are finished with your assessment for the evening. We could do one more test. It's called the pain point. And if you can just tell me, if you close your eyes and tell me if you feel 2 points or 1. Oops. All right. Your fingers, you turn them over here.
2. 2. 1.
Okay, that's within normal limits. Okay, now we're going to do the vibration test. And I'm going to make this vibrate. I'm going to place it on a bone, and you just tell me when you feel it and when you feel it stop. Okay? Close your eyes.
Okay, feel it. Stop.
Okay. All right.
Can you feel it? Stopped.
All right. Very good. I'm going to place something in your hand. If you can just keep your eyes closed and tell me what it is.
Feels like a ring.
Very good. All right, now we're going to write a number in your hand. You open your hand for me. And if you can tell me what number I'm writing in your hand.
Do it again, please. That's a figure 8.
All right, very good. Okay, I think we're finished with your assessment. We just want to go over the cranial nerves one more time. So cranial nerve number 1 was the is the acoustic, olfactory, which we forgot to test. And I don't have my smell here, but if you can close one side of your nostril and breathe in. Good, and do the other side. Very good. So the way we would test that is we would have 2 different smells and have you try to smell. Have you had any problems with your smelling?
Just sinus cold, stuff like that, nothing major.
All right. So that should be okay. Cranial nerve number 2 is the optic nerve, which we tested your vision, how well you do see, and then cranial nerves number 3, 4, and 6 deal with the ocular motor movement. Cranial nerve number 5 is the trigeminal nerve, which deal with the feeling in your face. Okay. Cranial nerve number 7 is the facial nerve, which is facial gymnastics. Cranial nerve number 8 is the cranial nerve number 8 is right now. Cranial nerve number 9 is the glossopharyngeal. And cranial nerve number 10. Sorry.
It's okay.
Cranial nerve number 10. Okay, cranial nerve number 12 is a hypoglossal, which we haven't tested that one either. So if you can stick your tongue out and move it side to side, that tells me your hypoglossal nerve is working. The vagus nerve and the spinal accessory is number 8, and that is to shrug your shoulders. Cranial nerve number 9 is I can't think of it right now. So I guess we're finished with your exam.